Welcome, everyone. Thanks for joining us today for a very special UNC Health Foundation presentation regarding the country of Uganda and the work that our UNC faculty does in that area. I'm very proud to be on this call with Dr. Ross Boyce of infectious disease and Dr. Raquel Reyes from internal medicine at Carolina. One of the things that we have tried to do this week is give thanks for all that goes on at UNC in our locality of Chapel Hill, in the state, in the nation, and of course around the world. Our focus today is definitely someplace around the world, and we're hoping to bring that place closer to you. Many of you may be missing out on travel right now, whether it's to people in your family close by or to people in your family far away. And by doing this today, we're not only showing you some interesting travel and some interesting pictures and the people and sharing more about what goes on in Uganda via Carolina, but we're also sharing a story of love. And that story of love plays right into the fact that UNC is busy all around the world, providing the best medical expertise they can in sometimes often very limited resources. And Uganda is one of those places. The second part of the story of love actually involves our two participants, who are not only incredibly brilliant physicians, but are a married couple. And their love shares paths way past themselves and into each other's passions. And one of the strongest passions, of course, is their love of Uganda, the people, and the work that they do there. So get ready for a lovely story, get ready for a lovely learning experience. And with that, I will pass it over to my friend and colleague, Dr. Ross Boyce.
Great. Thank you, Mary Margaret. Let me share our screen. So welcome, everyone. And thank you for taking the time to be here with us today. Even if the format is a little bit different, we'll try our best and we'll get right into things. Maybe. So, today we thought that we would take you on a bit of a trip as if you were coming to our site in Uganda as a visitor, as you were welcomed by the elementary school children. And to do that, we're going to take you on a little bit of a trip. Typically this would take about, what do you think?
7 days. Yeah.
About 7 days of your time to come visit us and our work in Uganda. And here's what we'll be doing over the course of that. Take the next one.
Sure. So this is the map of where we're going to be going. Obviously, we wanted to sort of give you a sense of what it would feel like to actually make the journey. It takes about 24 hours is probably the quickest you could get there, starting from Raleigh. We like the flight that goes through New York and on to Amsterdam. And then you fly down to Kigali in Rwanda, and then you hop over to Uganda, your final destination. Uganda, just to give you a brief orientation to about how big it is, it's about the size of Oregon. It's a pretty rural country. There's about 80 to 85% of the population of Uganda lives out in the rural areas. And then you can see there Lake Victoria, and Entebbe is right on Lake Victoria, which is the largest freshwater lake in Africa and second to Lake Superior, I think, in the world.
So typically the flight, after about 28 hours, you arrive at about 11 o'clock at night local time in Entebbe. And I thought this picture gives you a good sense of kind of what you feel like when you arrive, which is a bit blurry and tired and disoriented. And you get off the airplane, and of course you have to go through customs and get you can buy your visa there at the airport. And there's typically, you pick up your luggage, and then there's a driver from the hotel where you're going to stay who will pick you up. And even though I've been dozens of times now, I still get on the wrong side of the car when I'm there.
Yeah, so we usually like to stay at the Gately Hotel. So once you get to Entebbe, you're there, you get your luggage, you look through the sea of faces to find the guy that's holding a sign that says your name, so you can know, okay, that's where I'm supposed to go. You get in the car and you head to the Gately Hotel is where we recommend you stay. And this is sort of what it looks like. It's nighttime, it's late, you're tired. You're also jet lagged though, because it's 7 or 8 hours ahead. So you kind of feel like it's 3 in the afternoon, but you haven't slept well on the plane. Somebody will be there to greet you and then to show you to your lovely room, which looks like this. And we wanted to take a moment here. You may notice the mosquito net hanging. A lot of the work that we do is around malaria. I'm gonna let Ross talk a little bit about malaria in Uganda and why that's important and some of the stuff that we do there.
Yeah, and so the malaria net is a nice way to point out that malaria, if you're not familiar, is a disease transmitted by mosquitoes, the bite of the female mosquitoes. And it's a small parasite that gets into the blood and can be really deadly, especially in young children and folks who don't have a lot of immunity like most of us. And Uganda suffers from a lot of malaria. It actually accounts for about 5% of the world's cases, even though it's a relatively small country. And that's largely just by nature of the terrain and the environment and the weather. Malaria, despite everything, still results in about 400,000 to 500,000 deaths a year, about 95% of which take place in sub-Saharan Africa, and about 95% of those happen with kids under 5 years of age. So that's one of the main reasons I'm focused on malaria in Uganda, but it will be one of the first things you notice is when you go to bed, you put that mosquito net down.
And be sure to bring lots of DEET with you. DEET is good, and wear long sleeves at night. So you'll have a rest. It'll be hard to fall asleep, but when you do fall asleep, you'll wake up the next morning, get ready to make the journey. And this is coming out of your room at the Gately. It's probably the first time you really appreciate the beauty of where you are. It's this really lush green. It's always green. It's a tropical climate. It's right on the equator. So it's pretty much 70 to 80 degrees year round. And beautiful flowers, and you're smelling the flowers, and the birds are singing. There's over 1,600 species of birds in Uganda. It's just a very, very beautiful place, and you can sort of smell the red earth, and you can smell the vegetation and the flowers, and it's a really beautiful place. So then you will meet Moses Tours. He has a company now. When we started working with him 10 years ago, almost 10 years ago now, it was Moses and a couple of drivers, and now he has a tour company. And he has a fleet of 4x4s, which are important because this is what a lot of the roads look like. On your journey, you'll pass by a lot of fields of papyrus. A lot of papyrus grows sort of along the shores of Lake Victoria. You'll stop maybe for muchomo. This is the sticks in the bottom left corner are usually pork meat. If you're a vegetarian, do not order the muchomo. They don't have vegetarian muchomo, but they do have bananas, which you can see down there on the left. They have several different species of bananas. And I think they're the world's second largest exporter of bananas, provider of bananas. You might also stop for some fresh tilapia, fished out of the shores of Lake Victoria, and they like to hang them on the front of the vehicles. So when you're driving on this particular stretch of road, you'll see a lot of cars with tilapia hanging from the front. And I highly recommend getting the tilapia, whole tilapia baked at some point while you're there.
So on our first day after arriving, so you wake up and the driver picks you up there at the gateway, and it's quite a drive this first day, unfortunately. You'll still be a bit groggy, but I'm going to show you here where we're headed. And as you leave Entebbe, we head up through Kampala. Traffic can be a bit busy there, although they've recently completed a sort of bypass highway that makes it a lot more convenient. And then we head out towards Masaka and ultimately to our destination. This trip takes about, what, 4.5 hours?
Mm-hmm. 4.5 to 5 hours.
And on the way, you'll pass through the equator for the first time, about 2.5, 3 hours into the trip. And this is where it runs through, right there.
Yeah, north to south. That's me with Peter, one of our friends and drivers.
You may start to see some interesting animals along the way, and these are Ankole cows, which are southwest Uganda is a big cattle rearing region. And then towards the end of the drive, we will arrive at Lake Mbiru National Park.
Uganda has a whole lot of really beautiful national parks and a lot of really interesting and charming and beautiful eco lodges. that you can visit when you're there. This is Mahingo Lodge is the name of it. And this is sort of gives you a sense of the thatched roofing and all of the sort of locally crafted wooden furniture. This is where you'll spend a little bit of time, rest, relax, maybe see some beautiful animals. So these are some of the animals you will see. You can take a walking safari. A Uganda Wildlife Authority ranger will walk with you. You'll see zebras. It's one of the few places in the country where you can see zebras. They actually have giraffes there now. They brought a pair a couple of years ago, and now there are several families of giraffes there. I haven't been since the giraffes had come. Hippos. I took all of these pictures actually, except for the one on the top. That's a bush baby who is a nocturnal marsupial who comes to the lodge at night. There's a little family of bush babies they like to come and get fed at night. So it's a really beautiful place. You can do a boat tour, you can do walking safari, you see some beautiful animals and plants, enjoy the view.
Swim in the pool.
This is the infinity pool, and down in the sort of left corner, you can see that sort of brownish patch. That's actually a watering hole where all through the day, animals are coming and going to the watering hole. It's a really beautiful place to stop.
So after a nice night at Lake Mburu, and hopefully you're starting to get caught up a little bit on your sleep, we will take a short trip in the morning, just down the road, maybe 45 minutes to an hour, to Mbarara, which is the largest city in the Southwest region, sort of a regional hub for the area, and also I think the second largest city in the country, and a little bit more bustling. And even though it is, we say, the second largest city, it is far behind Kampala and really is not as big even as this picture kind of makes it seem.
And that's where our principal partnership is, and where it sort of all started several years ago. So when I started in Uganda, I was living there for a couple of years, and then Ross showed up a year after I had been there, and that's how we sort of met and fell in love. But Mbarara University of Science and Technology is our principal partner. They have a medical school, they have a school of public health, they have several scientific schools, and they have medical residents. So it's a very direct analog to UNC and UNC School of Medicine, and our main partners are in the Department of Community Health. So we wanted to introduce you to Edgar and Moses. And this next slide is actually a short video. So you're going to see peppered throughout our presentation here. Our colleagues were so excited at the idea that we were doing this, and really they'd love to meet visitors and to welcome people and to show them about our work and to show them about what we've been doing. So they went around last week recording little snippets, and we've included a few here. This is our friend Moses.
My name is Intalo Moses, and I'm the Executive Director of the PHID NGO. PHID stands for People's Health and Economic Development. It's an NGO that is running runs in the whole country, but specifically we're implementing activities in Kasese district. I want to particularly bring to note the long relationship that we have had with our long-standing partners, who's Dr. Raquel and Ross, who actually have worked together for nearly a decade in improving the livelihoods of the people in Kasese.
Actually, maybe we can pause before we talk a little bit more to have a poll question about languages in Uganda. Allison, are you able to?
There it is.
There it is. So more than 40 languages are spoken in Uganda. Which one of those is the national language?
Should we keep going?
I think we're supposed to wait until the poll's done.
We'll give people another 10 seconds.
All right. So the correct answer is English, which is actually very fortunate for us that we can do our work without having to learn some of these many other languages. Swahili is spoken by many of the people, especially at levels of government and at the sort of academic institutions, which allows them to partner fairly effectively with the rest of East Africa. But English is actually the official language, and you can usually find someone among your partners who speaks some English. So that was Moses.
Allison, I think, do you have to remove the poll?
Maybe can you X? Yeah, there you go.
There we go.
Go back, because I think you're gonna.
No, it's the next one.
Okay, yeah.
All right. So after meeting our colleagues in Mbarara, we will continue on and head out to Queen Elizabeth. And this will really be the first place where we really start to see some wildlife just along the road. And as you see here, some baboons hanging out on the barrier. This is about a 2.5-hour drive from Mbarara. And when we arrive, we'll be staying at the Katara Lodge, which is one of our favorite places to stay. And as you drive up, you'll have to go through the gate and sign in with the guard, and then they'll let you in. And this will be your view as you walk through the gate.
It's overlooking what you're seeing down below. It overlooks, it's sort of on this, up on this high cliffside, I guess, and overlooking the Rift Valley. That's what you're looking down into. And in the distance, sort of obscured by the clouds, on a clear day, you can see the Rwenzori mountain range, which separates Uganda from the Congo.
And so after arrival here, typically we might have a lunch, and then you'll be taken to your little individual hut cabin. You can relax. Sometimes we see elephants walking by in the distance. You'll hear tons of birds chirping. And as the evening goes on, you may choose to roll your bed out, which you can sleep under the stars there, under the net, which is an interesting feature there. And then after another good night's sleep, the next morning, very early, we'll head out on a safari.
We won't spend too much time on the safaris, and we found ourselves with a million pictures to share that would have taken too much time, but you can see elephants, you can see buffalo, you can see hyenas, you can see, in this part, there's actually tree climbing lions, which is this interesting behavioral thing that the lions do in this part. It's called Ishasha, where the lions are like lounging in the trees all the time. So you'll spend the day, you can do some more safaris, some more boat tours, come back and relax in the pool
Or
again.
you can stay at the infinity pool again.
Overlooking, and you can kind of see the mountains in the background of this one.
So after maybe a day or two at Queen Elizabeth, we'll finally make our way out through the Kazinga Channel, continue through the park past Kasese, which is sort of a border town and a main trade route between the Democratic Republic of the Congo and Uganda, out to Bugoye, which is our main partnership site and our field site for research and a lot of our development projects that we work on.
So Bugoye is a health center 3, and a little bit of context about that. We're going to show you what a level 2 health center is and a level 1, and we're going to explain what level 1 is thought of. But Bugoye is a health center 3, and those are situated mostly at the sub-county level and have an inpatient ward in addition to outpatient services. They have basic lab capacity, some basic IV medication capacity. They have a maternity ward. And so and are staffed by clinical officers and midwives. And this picture on the left is of the outside of the inpatient department. The picture on the right is the inside of the inpatient department. Most of it, the majority of it is kids. About 50% of Uganda's population is under the age of 15. So it's a very young population, and obviously a lot of the morbidity and mortality in the country is in childhood. And then there's sort of a smaller but women's ward, and then 2 beds for the men's ward. And that's the inpatient side. There's also a very busy outpatient department. This is the waiting room for the outpatient clinic where people come. They come in the morning, they sit and wait their turn to be seen by the clinical officers, and just sit until everybody's seen through the day. Often that's until 3 or 4 o'clock in the afternoon. This is Rachel, one of the nurses that we work closely with. She's fabulous. We love her. And then we wanted to introduce you to Shem, who is the in-charge. He's called the in-charge, so he's the head of the Health Center 3. We worked with him for all of this time. He is trained in ENT. He's a clinical officer. He is extremely charming and charismatic, and really would love to actually meet you in person, but wanted to make this recording for you as well.
So visitors, you're welcome on this guided tour. We have started with the maternity department, and these are some of the mothers who have come for services here. You can also see this beautiful facility of ours, so beautiful. So these mothers come here, they access a number of services, including maternity services, antenatal. Now during antenatal services, we also check for HIV/AIDS in order to work on the prevention of mother-to-child transmission of HIV/AIDS, just in case one is born HIV positive. And the UNC particularly is interested in the transmission of hepatitis B in the pregnant mother-to-child transmission. So UNC has a stake in this service. So in the days to come, we are interested in testing of mothers for hepatitis, so that we prevent transmission to the children. Besides this hepatitis, UNC is also interested in the treatment of people living with hypertension. We have a clinic here at the facility, which is directly sponsored by direct relief, and patients from the community have been able to benefit from the services given from UNC.
So just to, I would highlight that a clinical officer is probably equivalent training to, or maybe a parallel to like a physician assistant here in the United States. And so that's the highest level of clinician that is available within a sub-county, and that's 50,000 people. So there's no doctors until you get to a higher level, a hospital. And so certainly accessing care can be challenging. We're going to do one more brief video from Shem talking a little bit about sort of some of the partnership, which is a little more research focused, but we'll touch on that quickly afterwards.
Oh, dear visitors, you're welcome to the UNC office, and meet the staffs who work with us at UNC. The first one is...
Yes, I'm Babu Emmanuel, the field site coordinator. Nice to meet you. Thank you so much.
Welcome, welcome.
I'm Kiwa Jujeti, staff study RA. Nice to meet you.
Welcome.
You are welcome. I'm called Inid Mohindo, programs manager. PHILD is People's Health and Economic Development.
Welcome, madam.
I'm Paul Sabat. I'm an RA teaching expert, and I'm working as the store manager. Thank you very much.
Welcome. So our visitors, this is our beautiful vast UNC laboratory. At Boyce Health Center, we describe it as a level 1 health center laboratory, and we are proud to have such. Maybe please meet the laboratory technician in the laboratory.
Thank you very much. I'm Paul Desire. I'm the lab manager for this mass intensive research laboratory, and various research is run here, as you can see the research we have. So thank you for the support you always rendering to us to put up such facilities.
Really, it's a big support. We are very appreciative, and we still hope for more. Thank you very much.
We love Shem.
So just briefly, I mean, some of what they're talking about are some of the research projects that we have that are funded for example, from the National Institutes of Health or the Bill and Melinda Gates Foundation that have paid for some of that equipment. And a lot of those studies focus on malaria. The expert study that they talk about is about HIV. And we're also working on trying to improve access to vaccination for children. And that's on the research side. And then we also have a number of programs on the NGO or development side, which Raquel can talk a little bit about.
Yeah, Shem's sort of alluded to and mentioned a few of them, and we'll go into a bit more detail about one program in particular, but he mentioned the hypertension clinic. So a lot of folks out there actually have pretty severe untreated hypertension, and we're ending up with hemorrhagic strokes from untreated hypertension. And he was mentioning that we were able to secure an in-kind donation from Pfizer through Direct Relief to provide the medications that will last us for a couple of years to be able to serve those people. And people come from even not just the surrounding villages, but some of the neighboring, even larger towns to receive treatment in the hypertension clinic, which is the first rural hypertension clinic in Uganda. There's over 500 patients being served now. He mentioned the hepatitis B campaign that we're just starting that's funded through the Weyerhaeuser Foundation. We're pretty excited about that project as well. And then we're going to talk a little bit more here in the presentation, give you a demonstration of ICCM, which is a program designed to help kids under 5 with the 3 most common illnesses that they suffer from.
So after our tour of the health center by Shem, we'll head out into the community a little bit to learn a little bit more about Bogoye. And as you see on the left here, this is the big town of Bogoye. That's the main strip there, and some shops and we might stop for lunch at the one restaurant in town, Mama Collins, which is a little one-room.
I think there's a competitor across the street now.
Okay,
yes.
Yeah.
It's a one-room shop in the back of storefront where you can get some posho and local food to eat.
And of course, just walking around town as an American, you stand out and of course attract the attention of the kids who are out and about.
They like to practice their English. Hello, how are you? It's really sweet.
And then our Emma, the one who you met as a field site coordinator, will take us out on a journey, and he'll lead the way as we head out into the villages a little bit to kind of see where most people live. And this represents not only our study areas and our partnership areas, but most of Uganda.
Yeah, I like this image, and some of this is some of the most compelling parts, I think, of the whole presentation, is just really trying to get a sense, which is hard to do, of course, in just photographs, but of how mountainous this terrain is. So we talked about how most of the population of Uganda by far is rural, but the area where we work is also very remote. It's mountainous terrain, up and down on footpaths. Maybe you can pass in a motorbike. Sometimes you can use a motorbike to get some places, but you can't drive there. So you are walking, and these are the hills, which we would, Ross and I would like, before we had kids, take a weekend hike, and spend the day climbing this to the beautiful mountain. And this is just the foothills of the Rwenzori. So it's, this is where people are living and trying to access care. And most of them are sharecroppers and subsistence farmers. And you can see, like, after all this hiking, you get to the tops of these peaks, and this is where people are living. And this is also where the level 2 health centers, many of them are situated at the sort of the tops of the hills and the surrounding villages. And level 2 health centers, so we talked about what level 3 was. We started in Embera, which has a regional referral hospital. Then we went to level 3, which is our main partnership in Bogoye. And then there's the level 2 health centers, which is a single building with 2 rooms, which can do basic testing for malaria. They have rapid diagnostic tests. They can do pregnancy testing, pretty basic antenatal type care, vaccines, some pretty basic services, and then they refer on for things that need a higher level of care.
But even this, which you might think, there's 8 of these in the sub-county, 1 in each what's called a parish. And, you might think that these are more accessible, but we've done some work with some of our research. And what you see here are the different health centers scattered throughout the sub-county and the amount of time it takes to walk there from any one point. And you can see that a significant proportion of the population lives by foot an hour away. So you're talking about if your child is sick with a fever, you're going to end up walking through those mountains for an hour just to get to a level 2, which is that 2-room building that we just showed you.
Maybe you can explain what the map
and
shows.
so all these level 2, I think people can see my mouse, but these are the level 2 health centers. And so anywhere where you see these lighter colors and the purple, down here, this is the number of minutes that it takes to get there. And so, unless you live very close by, it's a journey to get healthcare. And if you need, for example, IV medications because your child has severe malaria or they have pneumonia, which are really some of the most common conditions, and you got to get here to level 3 health center. I mean, it's a real burden and a real journey. One thing that I would point out that'll transition into what we're doing next is all these smaller little crosses are community health workers and where they live.
So that's what we're going to talk about next. So you can see here, this is another just good image, I think, to sort of get a sense of what it's like. All of those little colored rectangles are little mud dwellings. Those are the people's houses sort of peppered through, scattered through the mountains. And what Ross was just talking about is the village health workers, all of those little pluses that on the map that you just saw, those are considered level 1 in the health system of Uganda. So they're volunteers. They receive some basic training through the government usually. And then in theory, they can provide what's called ICCM services, so services out in the villages where they can diagnose and treat children under the age of 5 with the 3 most common causes of morbidity and mortality, so pneumonia, diarrhea, and malaria, and they can diagnose and treat that out in the villages and spare these women the arduous task of going up and down the hills with their sick child to try to access care. In reality, the government does not actually have funding to really implement the program well. So that's been one of our principal focuses in the service-oriented work that we do is what's called ICCM. And this is them putting up the sign. We just expanded into the neighboring sub-county to do an ICCM program and train some village health workers and equip them with the supplies that they need to be able to do this. This is Augustine. He's our site coordinator for our ICCM program, and he's going to introduce you to a VHT.
Over the 3 conditions. These VHTs treat 3 conditions. Among them, we have pneumonia, we have malaria, and diarrhea. And they treat young ones of under 5 years. So we start from 2 months to 59 months. That is 4 years and 11 months. So currently here, I'm at the VHT's place. We are going to see what this VHT does in a simple way, and to a summary, just explain a few things that it does whenever a patient comes.
So what he's going to show you next. So this is a village health worker there in his home. That's his home that you're seeing, and he's sitting outside with his box. And this is where he receives mothers with their children. And he's going to show you what the box is. We have these boxes built, and we provide the supplies that go into the boxes. And he's going to show you what he uses to, because village health workers, they have to be able to read, but they're not well educated. They don't have sophisticated levels of education, and they're providing this service. So they have a pictorial sort of algorithm that they follow in order to provide the care. Do it next, yeah.
By the names of Mbusa Nelson Kipura, I'm one of the 20 VHTs who are working with P-Healed. When I receive a patient at home, I welcome her. After welcoming, I ask the problem she's suffering of. Then after asking, then I go directly to the years of the baby. Then after, when I'm using my Bible here, then after knowing the problem she's suffering of, and knowing the years, then I go directly. I come to my what? To my toolbox. Then everything's there. I have for this is a box of gloves. This is oros and zinc. This is amoxicillin. This is a sanitizer. This is cotton. This is a timer. And this is a cotton wool, which I use. Those are the things which I use when I'm treating my patient. And secondly, we appreciate for the work we are doing, and the people are thanking us for the work we are doing in the villages. They have started calling us nurses. Now we appreciate with that, and may God bless you.
This is another picture of a different village health worker. He's pricking the finger of a child to perform a rapid diagnostic test for malaria. And another image of a mom, you know, looking stressed and being treated by a village health worker there in her village. So she didn't have to make that journey with her sick child on her back to try to access care that who even knows if they're going to be stockouts. It's a really, we're very, very proud of that service that that we've been able to provide, and grateful to Johnson & Johnson for their support.
So after visiting with the VHTs and learning a little bit more about what they do, and sorry, VHTs are the community health workers, the village health teams. We'll walk back down the mountainside, and you can see here kind of what that journey looks like. And I'll just quickly tell a story that, you know, that I was out mapping and trying to learn where all the different villages were located using a GPS device. And these were two community health workers who were showing me around. And telling me, you know, one village starts here and the next one starts here. And as we were doing that, I could not keep up with them up and down the hills. And, you know, I was in the Army for 5 years and I had my, you know, boots on and hiking boots. And here's this woman with a baby on her back and flip-flops on that I could barely keep up with. So they're very used to the hills. And so after coming back down the hills, we'll get in our car or our Land Cruiser and head up further into the hills and stay the night at one of our favorite places, which is the Snow Lodge, which is really up just on the border of the Ruwenzori National Park and is really a very unique landscape. It's one of the, it's actually sort of a rainforest up
It's
there.
really beautiful. Mm-hmm. Oh, we can do the poll. Sorry.
Oh, okay.
Yeah, Allison, can you do the next poll? Not the one about the gorillas, but the one about the Ruwenzoris. So how long does it take most people to reach Margarita Peak? So Margarita is the highest peak in the mountain range. And for reference, it's 5,109 meters from above sea level. I've actually made this journey myself. It's really beautiful. There's ice at the top, although it's of course melting away as with global warming, the ice caps are melting. All right, so it actually takes most people 7 days to get all the way up. Although I have been told that your porters, the folks who are your guides, can actually get all the way to the top in 2 to 3 days themselves because they don't have to stop to acclimate to that altitude. But it takes most people 7 days to reach to the top of the peak. And then it only takes a day and a half to get back down. It's very beautiful. And the Snow Lodge, the images here are really, it's one of our favorite places probably on the planet. There's no internet, there's no phone access. You can barely, I mean, you have some solar charging capability, but you hear it's the Mbuku that's rushing by from the mountains, and it's this beautiful, it's so dark, and there's beautiful water rushing and lush vegetation, and it's just a very peaceful, relaxing retreat.
So after a night in the Snow Lodge, we are on our way back to Kampala. We'll do a quick stop about 1.5 hours north and 4 portal for one quick visit to see the Crater Lakes, which is one of the few places in Uganda that you can swim without fear of schistosomiasis, which is a kind of worm that lives in a lot of the waters like Lake Victoria. There's also spots to see monkeys and
yeah, those are black colobus monkey on the left and a red vervet monkey on the right. There's a whole bunch of different, I mean, just the wildlife there is amazing and the landscape is beautiful. So it's another beautiful eco lodge. This is the view from the eco lodge. So another place to stop and relax before you start your very long journey back.
right. And this is the most challenging part because it's about 6 hours drive back through Kampala to get back to Entebbe. And your flight is going to go out at about 11 o'clock at night. And so you grab some dinner somewhere along the way. It's dark, a long time on the road. And of course, you can't get that close. So you've got to lift all your bags up, drive them up in a cart. It's quite a journey. And then we typically, like after a 6 hour ride, we pay the $30 to go into the so-called first class lounge where you can get a shower and get all the dust off you from the car ride and enjoy a local drink and some food while you wait for your plane to take you home.
And 24 hours later, you'll be back home again.
And just as confused as to what time it is. So thank you for joining us on the trip today. And I think we'll stop the show, and I think we have time for a few questions. I'll turn it back over to Allison and Mary Margaret.
Well, that was fantastic. And I didn't mention before, but I've actually had the pleasure of taking this tour in Uganda and seeing the pictures again, and the beauty of the landscape and the beauty of the people is a great memory, and hopefully it won't be my last time there. One of the things that Raquel mentioned was the community health workers were sponsored by our partnership with Johnson & Johnson, and we're very appreciative of that. One of the things about getting sponsorships from corporations, it helps us secure other relationships that want to help, and the very smallest gift can make such a major difference. So just an incredible experience of a lifetime. So I have a couple of questions here that I want to ask that have come in. Thanks for sharing that you guys fell in love there, but for the romantics in the crowd, can you give a little bit more of how you met? Were you working on research together there? Or I know, Raquel, you were there first, correct?
Yes, I was living there. I moved there about a year before Ross first came to visit. And we actually don't tell many people the full story of it. It's kind of a little bit scandalous. I was officially his attending, yes, his supervisor when he first showed up, but obviously we stopped that afterwards. I had been living there for a year doing the global medicine program for the institution that I worked for before I came to UNC. And then Ross came and was interested in the malaria work that was happening there. I think you had already had an interest in dengue and sort of vector stuff,
right?
And bug sort of things, but was not planning on having a long relationship in Uganda. And then came and met me and saw the site and met the people, and it's hard not to be moved by what's going on there, like when you're there and you see it. So yeah, and you started doing a lot more research after that.
Yeah.
And then we got married there a year later. Yes, and now we have 3 kids, 5, 4, and 2.5. And
I'm sure you're anxious to return.
Yeah.
Obviously, it's a place you love for many reasons, and thanks for sharing that personal part for us. I have a couple more questions that have come in. So there's a question about what is the food really like there, and is it safe for Americans to travel there?
So I can start with the safety part. I mean, it really is very safe. I mean, in the big cities like Kampala, of course, there's petty crime. Things can get stolen. Burglary is a concern, but out in the rural areas, especially where we have established partnerships, those things just are not common. One of the things, really the biggest safety risk is the roads. Just by nature of a lot of unregulated driving and poor road conditions and poor maintenance of vehicles, probably that is the most dangerous part, and perhaps malaria. But if you take chemoprophylaxis, and which is the pills to prevent it, it's really very safe. And I have never noticed, at least in the areas where we work, any sort of anti-American sentiment.
No, if anything, they feel very motivated to sort of, I mean, they're very hospitable and like take a lot of pride in welcoming guests and visitors and taking good care of them and treating them well. So I always felt sort of extra super safe and very protected. And I mean, everybody was always looking out for me.
And then the food.
Oh, food, yes. Yeah.
It's a lot of staple foods and kind of root crops. So sweet potatoes, English potatoes, which are just regular white potatoes, Irish, sorry. And posho, which is kind of a corn meal type product, almost like a grits.
Kind of.
Like a cold, sticky grits.
Yeah. And a lot of pork and chicken. There's not a lot of, like, for visitors, you can find things like that have Western style food. The people there tend to eat just a lot of posho. There's not a lot of starvation because there's just I mean, it's such a rich, like, tropical land, like things just grow very easily there. But there is, in the rural areas, a lot of malnutrition where kids will eat just posho and not have enough access to meat, in particular to proteins and a variety of vegetables. But there's a lot of vegetables and fruits and grains.
I recall that too. A question about just the timing right now and how COVID has affected Uganda. Realizing that you're not able to travel there, I'm sure other institutions who provide care and services there are under the same sort of hold on travel. What are you hearing from your people on the ground, like Shem, that you mentioned in the video before? How is the effect being seen there?
We had thought they would be relatively spared, and they were for quite a long time. Maybe only a month ago or so did we hear of cases happening out in the rural areas. And I would say it's fully there now. Before there was concern it was just more in the urban areas, but the whole district staff at the district headquarters came down with COVID about a month ago. The perhaps one or maybe two sort of bright spots in that is, with such a young population, as Raquel mentioned, I think half are under 15 and something like 75% are under 30. A lot of the risk factors associated with older age and chronic medical conditions aren't there. So, maybe it will not be as devastating as it is in some of the places where the populations are older. But yes, it's definitely been a challenge on top of the challenges that we already listed in the PowerPoint about getting access to care and some of the flooding that happens with the heavy rains and things like that.
I think that's been the main effect so far, is that there's just not the same degree of funding and support going to those other sorts of efforts that are not specifically about COVID. And then all of the things that you need to do to mitigate COVID and really have an impact on these remote and rural communities. So when you have a lockdown and suddenly, like, you already are struggling to get care out in those areas, you have a lockdown, and then even that little bit that you were able to do is impacted pretty seriously. And the same thing with supplies, things like that. So that part has been not a directly, like, although we are starting to see a little bit more COVID now, like Ross was talking about, but those sort of secondary impacts, I think, have been pretty significant.
Okay, I have another question. I have two more, actually. Uganda has a history of brutal leadership and atrocities, and whoops, screen just went off. Sorry, guys. In adjacent countries like Rwanda, what is the country like now in terms of human rights and peace?
Yeah, so I mean, Museveni's still there. It's been a long time. He's been there since 1986.
Yeah, that sounds right.
So It's generally peaceful. Around election time, there are sort of skirmishes and political sort of demonstrations, and I think some corruption, that where the government is really trying to squelch the opposition. So that's still definitely a thing. On a day-to-day basis, there's not a lot of like violent sort of uprisings and lootings and riotings and stuff like that. But in terms of the political system and real democracy, probably not so much.
And I think the big test will be, Museveni, the current president, is in his late 80s, I think. And he's been there for almost 40 years now. So what happens after Museveni will be a question. But, fortunately, it has been stable for a while. As far as, the area where we focus, and we do try to focus on the people that we work with out in the Ruwenzoris, they are a little bit of a different cultural group that does feel some separatist nature and perhaps maybe more closely aligned with some groups on the other side of the border in the Congo. But again, those have been relatively low level sort of political skirmishes.
Yeah, I agree. It's really striking, actually. There's a lot of diversity, ethnic diversity within Uganda, and also religious diversity as well. But there's not a lot of really overt fighting among people themselves. It's very harmonious and peaceful, and it is quite interesting, that part of it. There's not a lot of like overt terrible tribalism.
Okay. And our last question is, what is the greatest need that you see now for your program?
I think we always feel anxious that we don't know how long we're going to be able to provide the services that we're providing. So I think about that a lot and feel a lot of anxiety about that, about not having that security, I guess, always feeling like, what are we going to do? Like, what can we do next? And that's just to sort of sustain what we're doing now. And it would be great to be able to, like, some of the things that we're doing really have shown a lot of promise, and I think could be beneficial and relatively easily scaled in other similarly rural or remote parts of the country. So like grand ambition would be like to be able to do this kind of work in other parts of the country. But for now, I would say like that sort of wanting that kind of security and being able to continue what we're doing.
When we recently expanded with the Johnson & Johnson funding into Maliba sub-county, which is the next sub-county over, we are supporting the community health workers in 10 villages. So 2 community health workers in 10 villages, but there's nearly 40 or 45 villages in that sub-county. So it's, there's still a lot of people who are not able to access that care. And really for the number of people that it serves, I think we probably spend on the order of $1,000 to $1,500 a year per community health worker to serve, hundreds of kids, so that they don't have to make that trip to the health center to get treatment for malaria, which, in some of the villages where there's a lot of malaria, a kid can get malaria 4 times a year, 5 times a year. And so it makes a big difference.
So just to repeat that, so a gift of $1,000 to $1,500 can provide a community health worker for 1 year.
Yeah, I think that's right. Yeah.
Okay. I think that's, we're getting close to wrapping up here. So I'll just say again, thank you for a really great conversation. I think that, and I hope that everyone that listened in was able to learn a lot about a beautiful part of the world and 2 people that are doing beautiful work there.